Good afternoon. I am Professor Joe Thomas. Thank you for asking me to speak on behalf of children in difficult settings and the impact of coronavirus pandemic on those children. April 2nd was Autism Spectrum Awareness Day. Children with autism presents a potent reminder to the vulnerable children's unique psychosocial and mental health support needs. The breakdown of vital support systems and social networks as a result of COVID-19 exacerbates the obstacles that children with autism face in exercising their fundamental right to learn. The coronavirus-induced public health crisis has snowballed into a global humanitarian crisis. Practically all corners of the world is touched by this pandemic. The COVID-19 pandemic has significantly impacted all aspects of human civilization. Healthcare, travel, work arrangements, education, and all major industries are impacted by this pandemic. However, children's vulnerability has been disproportionately amplified in this crisis, and it should be carefully monitored and addressed. If appropriate remedial measures are not in place, the impact of COVID-19 pandemic will leave a generational impact on several children. I would like to highlight a few issues of great concern for children in the context of COVID-19 pandemic. Preventing COVID-19 disease is possible through a few simple measures that includes frequent hand washing, practicing sneezing etiquette, keeping a safe distance, and the use of masks by people affected or suspected to be affected by COVID-19 disease. But practicing all these are difficult propositions for many children, particularly children in difficult situations such as children in refugee camps, children in detention centers, children under juvenile justice systems, children with special needs, disabled children, and children in conflict-affected settings. Many girl children and disabled children are further marginalized due to COVID-19 pandemic. Many governments have closed schools in response to COVID-19 pandemic. According to UNESCO, these nationwide closures are impacting over 89% of the world's student population. This represents 1.54 billion children and youth enrolled in schools or universities, including nearly 743 million girls. Schools are much needed safe space, access to free midday meals, and access to psychosocial support, including mental health support services for many children. Many of the children may not go back to school when the schools reopen. Girl children out of school are more vulnerable to violence, sexual exploitation, child marriage, and deprivation of the growth of their human potential. Out of school boys may get under the influence of gangs and drug use. The protective function of schools on children in vulnerable settings is well documented. Education response must prioritize the needs of adolescent girls at the risk of reversing 20 years of gains made for girls' education. Approximately 67 million children worldwide do not attend school at all. In many cases, low-income families either cannot afford to send their children to school or they keep them at home to help with duties that are associated with household source of income. The impact of COVID-19 crisis will be different on them than the children who attend school. Rebuilding societies after the tsunami of coronavirus disease calls for specific mitigation efforts. Ensuring social protection and social security measures targeted to vulnerable children and children in general are essential. When schools reopen, many children may need psychosocial support to cope with the trauma they have experienced due to the disruption of social support functions due to the COVID-19 pandemic. Children who may drop out of the school need special care and attention. Ensuring programs to reduce school dropout should be part of the COVID-19 mitigation efforts. Programs to mitigate both the immediate and long-term disruptions to education being caused by the COVID-19 pandemic need urgent policy and program interventions, with a focus on ensuring that girls and poor children who will be hit the hardest by the school closure can continue their education. It appears that the care and treatment needs of children affected by COVID-19 disease is not receiving adequate attention. There's a general perception that children are less susceptible to COVID-19 infection. However, this perception did not factor the differential impact of the pandemic on children. When COVID-19 infects parents, children do suffer. Asymptomatic infections are not uncommon among children. Determination of the transmission potential of this asymptomatic patient is essential for guiding further interventions. The relatively low COVID-19 infection rate among children needs further clinical studies. Perhaps it may give clues to the prevention among the adults as well. There are various coronavirus prevention vaccine candidates are in pipeline, and they are in various phases of clinical trials. The vaccine scientists and children's advocates should ensure children's interest also should be taken into consideration when coronavirus vaccines are being tested in clinical trials. The COVID-19 disease has presented severe stress on health systems. It appears that much needed healthcare resources are diverted to deal with the impact of COVID-19 disease. In many settings, routine immunization for children has affected severely. Routine maternal and child health programs also destroyed by COVID-19 pandemic. In an unprecedented move, the Global Polio Eradication Initiative has recommended suspending polio vaccination campaigns to help stop the spread of the novel coronavirus. In the advanced phase of COVID-19 pandemic, there is a need to ensure the chronic care and treatment needs of children affected by other non-communicable diseases such as diabetes, cardiovascular disease, and pediatric cancers are to be taken care. COVID-19 pandemic may exacerbate several pre-existing maladies. UNICEF estimates that globally 165 million children under the age of 5 experience stunt growth caused by lack of proper nutrition. The disruption of food logistics caused by COVID-19 may exacerbate the situation of malnutrition further. In most critical period of child's life, nutritionally speaking, is the first 1,000 days. If children go hungry during this time, they are significantly more likely to be underweight or experience stunt growth. There is a need to monitor the children born during the COVID-19 crisis, how their nutritional needs are being affected. It is believed that poor nutrition is responsible for 3.1 million deaths of children under 5 annually. That is 8,500 children die every single day due to hunger. This situation may be exacerbated by COVID-19 crisis-induced food logistics disruption. The UN Resolution on Sustainable Development Goals emphasize the importance of accessible, timely, and disaggregated data with a focus on the poorest and those are the most vulnerable and in vulnerable situations, such as children and young people. The post-COVID-19 pandemic phase should urgently pay attention to the key data gaps in monitoring child and young people specific SDG targets. The data disaggregation needs is to be a significant concern for the advocates for child rights and child-centric psychosocial and mental health care needs. The coronavirus-induced public health crisis has snowballed into global humanitarian crisis. The crisis is also an opportunity to refocus on child rights and ensuring greater maternal health and psychosocial support for children in the context of COVID-19 pandemic. Thank you very much.